Welcome to this episode of Issue at Hand. I'm Nändi, and I'm the Outreach Coordinator at Elder Services of the Merrimack Valley and North Shore. Elder Services is a private nonprofit that serves the needs of elders and adults with disabilities in Greater Lowell and beyond. Today in this episode, we're going to talk about one of the barriers to health that often comes up for the elders that we work with. It's a barrier that is not quite as obvious as other health barriers, but once we talk about it, I think that the community will agree it really comes up as an issue pretty frequently. And that health barrier is transportation. Today, we actually have an expert on that topic, Alex Luciano. She's the coordinator of the Care Ride program at Elder Services of the Merrimack Valley and North Shore, which is a new transportation program we're going to get to hear about today. Welcome, Alex.
Thank you for having me.
Thank you for being here. And would you just start by telling us a little bit about yourself?
Well, my name is Alexandra Luciano. The community knows me as Alex Luciano, which I love. I'm the program coordinator for Care Ride at Elder Services. We've been working on this field for about 18 years now. Before I came to Elder Services, I was working on the mental health field at Leahy Health Behavioral Services.
Okay. So before we get into the Care Ride program, can you talk about how Elder Services first identified transportation as an issue?
Sure. In 2016, Elder Services conducted a need assessment service. As a result of that, one of the biggest issues that they saw was transportation. So when I came aboard, I needed to educate myself. I knew transportation was an issue, but I needed to, get information and do some research. I find out every publication I read and everywhere I looked, transportation was one of the three biggest issues in the community.
Top three.
Top three. And the numbers scare me because I read somewhere that 3.6 million of Americans miss their medical appointment due to lack of transportation.
3.6 million.
That's a huge number. And the effect that has on that community is big, because when you miss your medical appointment or you miss your test, you end up having, biggest or higher health issue. So that's also putting, a pressure on the economic, because if you don't go to your doctor and you end up in the hospital, you end up with a bigger bill. So
right. It's almost like a snowball issue, right? It just gets out of hand and puts such a big strain on everybody, right?
Yes. In 2016, the health system expend more than what they were supposed to. They spent about $15 billion just because people were not able to get to their doctor's appointment. And that's not only affecting the consumers or the patient, it's also affecting the family members, the caregiver, and the health system as well, such as insurance company and the taxpayer.
Mm-hmm. Yeah. Right, that's incredible. Mm-hmm. Yeah, Lowell actually had a greater needs assessment that we did last year in partnership with the Greater Lowell Health Alliance, and transportation also came up with that as well. So it's still been coming up on the forefront with every needs assessment, I think, probably all over the area.
Yeah.
Can you talk a little bit about, from the identification of transportation as an issue, how this vision developed for this program?
Yes. Justin Jordan is one of our program coordinator actually one of the program manager at Elder Services. He managed the Brown Bag program, the community market program, as well as Care Ride. He worked hands in hands with the community, our population, the population that we serve, and he also identified that transportation, it was a big issue. Consumers were approaching him, and as a result of the service, him and one of the directors of Elder Services, they put together a proposal. And as a result of the proposal, we got partially funded by Lowell General Hospital, and that's how Care Ride was created.
Okay, wow. Mm-hmm. So now that Care Ride is started, can you tell us, what is it? What does it look like?
Well, Care Ride is a non-emergency medical transportation pilot program, because we're still in that pilot phase. Is designed to provide transportation to and from non-emergency medical appointment. The program was designed to be the last resort for consumer we know that there's programs out there that that community is using, but we want to fill up the gaps. So that's why CareRide was created. We were designed to be the last resort for consumer. And the program is powered by Lyft, and we also have medical transportation vendors available for consumers.
Okay. So can you talk a little bit about how CareRide as a last resort kind of complements, like what other transportation resources are out there in this area?
Yes. Consumers, some insurance, they pay for transportation. So some insurance have programs that they provide transportation. Also, the Lowell community, which is the community that we're serving right now, the greater Lowell area, they have the road runners.
Right.
They have consumers who has mass health qualify for PT1.
Okay.
So CareRide actually is complementing or are helping those programs because sometimes they need enough time. They need 5 days ahead to use those type of programs. So CareRide actually is an on-demand program. So if a consumer is able to get in and out of a regular car, they can call the day before, they can call 2 days before. They can even try calling the same day if they need transportation and they already enroll.
Wow, okay. So yeah, it definitely acts as a supplement to the other resources transportation-wise that already exist. Okay.
Yeah.
How does the CareRide program actually work, like for when an older adult books a ride for a doctor's appointment? What does it look like? Like, do they have to, go somewhere to pick up the ride, or does the person knock on their door? What is that like?
The program is powered by Lyft. Right now, there's share companies like Uber, Lyft, and we powered by Lyft. So it's usually consumers when they think about those things, they think about technology. And Lyft is they don't need to have a smartphone, or they don't need to have a computer to receive their notification. So the process is consumer will call me, I enroll them into the program, and when they need the transportation, they call and let me know date and time. Usually they get scheduled for the day of the appointment, and they get all their notification by phone calls. They can choose phone call, text. They can get their notification on their home line, landline, yeah, or they can have a family member as well to receive those notifications for them. So it's usually they schedule the pickup time, and usually in a period of 5 minutes in between of the time that they choose to be picked up, that's when they get picked up. So it's very secure and very easy for them to use it. So they know exactly when the driver is going to be in front of their door.
Okay, that's very helpful to know. As far as CareRide and the older adults using it, who qualifies for the program?
Anyone who is a resident of the greater Lowell area, because right now we just offering the services on the greater Lowell area, who is 65 and older, or disabled, because we know that there's people that are under 65 who are disabled, and that they have tried for transportation and nothing else is available for them, or their regular transportation is not available for the ride that they need.
Okay. Can you talk about, for folks who might need a wheelchair accessible vehicle, is that possible with CareRide?
Yes, we provide transportation for handicap bound consumer, and but those need to be requested 5 to 7 days before the day of the appointment, just to guarantee that the transportation is there, because usually those medical transportation vendor, they're pretty much booked. So we want to make sure that that transportation is available for them.
So advance notice for an accessible vehicle. Okay. Is there a cost for this service? And if there is, how do elders pay for it?
Okay, and good question. Consumers, it's subsidized. CareRide is a subsidized program, so consumers are responsible to pay in a small portion. So we charge consumer $4 per ride if they're going around the greater Lowell area. If they need to go outside the greater Lowell area, it's $10 each way, and they can go to Boston, Burlington, Woburn, anywhere outside the greater Lowell area for $10 each way.
Okay. What routes are you often seeing? Like, do you find people are going, Chelmsford to Lowell, or to Westford, or, what are you kind of seeing as far as what are the common routes that people do?
Because we offering services around the greater Lowell area, we get consumers from, the surround towns from Chelmsford, Tewksbury, coming to Lowell to come to either Lowell General Hospital
Right.
or the satellite office that they have with specialists.
Okay.
But we also take consumers to Boston, to Tufts Medical Center, Mass Eye and Ear, all the Boston hospital. We technically take consumer, but we also take it to like surround towns hospital, like Emerson Hospital,
yep.
Harbor Vanguard.
Okay.
So those are places that we also transport consumer.
Right. And you've mentioned this program for transportation covers Greater Lowell area. What town specifically does that cover?
Okay. Greater Lower has a region, and
okay.
bear with me if I miss one of the
Yeah.
towns, but I know it's Lowell, Drake, Chelmsford,
Okay.
Tyngsboro, Tewksbury,
Okay.
Drake.
Okay.
Did I mention Drake?
Dunstable, maybe?
Dunstable and Westford.
Okay.
Yeah.
Okay. Thank you for that. For folks who either want to refer themselves for a ride to a doctor's appointment or refer a loved one or refer a client if it's a provider, what is the referral process?
Right now, how the program was started, it was by referral. So we're grateful enough to be partnered with COA. So we get referral from the COA or senior centers. We also get referral from Lowell General Hospital. Nurses, caseworker, they all refer consumer to our program. In our home care department at Elder Services, because they usually see the consumers first and they can assess their need. So we get a lot of referrals from in-house, from our home care department. And there's also many agencies outside those referral source that they already know about the program, so they all referring. So caseworkers from different agencies are referring consumer, doctor's office that they see that consumers are using our program, so they're referring consumers, patients to our agency. So pretty much everyone around the Greater Lowell area can make referrals.
Okay, so you've mentioned the doctor's offices and hospitals and senior centers. Are there any other organizations that you'd like to mention that have been really responsive with the program and have connected community members to it?
Sure. CDI was one. Community team one. Community team.
Teamwork.
Also, Lowell Community Health Center.
Okay. Awesome.
Yeah. Circle Home is making referrals, and some nursing homes around the area. Some nursing homes that they have rehab. They provide rehab services. Sometimes they refer consumers. They try to, because usually when a patient is there for a short period of time, usually the family members are the one who take them to the doctor's appointment while they're there. So sometimes they try to alleviate that process and they make referrals to us. Or sometimes the consumer that they don't have nobody else to take them to the appointment. So
okay, all right, that's helpful to know. For folks who are making a referral, either for themselves or for a loved one or for a client or consumer, what's the ideal time frame for making a referral? If I know that my loved one has an appointment in 2 weeks, when should I call you?
Referrals, they can submit referrals at any point because it's good for them to be enrolled. So as soon as you know somebody needs transportation or whatever they're using is not enough, you can submit a referral. There's not a period of time. To call for an appointment, if the person or the consumer is mobile and they can get in and out of a car, 2 days, a day before is fine to refer them for the appointment, like if they're already enrolled. Even if they're not enrolled, you can have them call us. But if it is a handicap-accessible consumer, handicap-accessible being needed, then those we need 5 to 7 days just to secure.
Right, you mentioned that. So when you talk about folks who are enrolled in the transportation program, enrolled simply means that they've called you and said, I might need a ride at some point in the future, right? Like they don't have to be signed up for a particular insurance or a particular service. It's just they call you and you enroll them, meaning they have access to that transportation program.
Yes, it just makes the process easier. Like when I enroll a consumer in the system, it's just like I already have their home address, they have their contact number. Usually if they want to have a family member or a caregiver to have access to the transportation, they can, all those questions I asked before, also I assess the consumer's need. Like if they need assistance getting in and out of the car. If they traveling with a cane or a walker, or if they need an oxygen tank. Also, when I enroll them, I ask questions such as, do you have a service dog? So all that is good to put it on their profile. Some information gets available to the driver. The driver that before they go and pick up a consumer, they already know that person has a service dog, or the person is riding with somebody else because they need assistance.
Right.
So
that's helpful to know. So serving an older adult population, how user-friendly would you say CareRide is, and especially for folks if they don't have a smartphone? How does that work for?
At the beginning, a lot of consumers, and thank you again for asking that question, because a lot of consumers, they were kind of skeptical because they feel like using Uber or Lyft or something like that is going to involve technology. And fortunate enough, CareRide is available. They can receive notification by phone calls, landline, and is very, very easy for our consumer or the population that we're serving.
That's good. I'm glad to hear that. Can you talk a little bit about like the safety features built into the program to kind of ensure that older adults feel comfortable using it and that their caregivers also have a sense of security with using a transportation program?
Yes. When we schedule a ride and a driver gets dispatched to the location to pick up that consumer, on our end, we get a notification says that driver passed all the background. Background check, yes. And before that driver gets to their location, when that consumer receives that notification call, they're going to receive the name of the driver, the car that the driver is driving, color, make, model, as well as the license plate. So all that they can have before the driver gets in front of their house. So that gives the consumer peace of mind. Also, if they add a family member or a caregiver on the profile, that caregiver will receive all those notifications. They will know when that person was picked up, when was dropped off, and the family member can also check, click that link on their phone or their computer, and they'll be able to track that family member all the way from the moment they get picked up to the moment they get dropped off.
That's really got to help for people reassuring that their loved one is safe, that they can literally see the route going and where they are. Is there a capacity for the rider to bring anyone with them, and does it cost anything if so?
Consumers can ride with up to 2 more people. Besides themselves with no extra charge. I just need to know when they call to arrange their transportation, they need to let me know I'm riding with somebody else, or I'm going with 2 people because I need more assistance.
All right.
And there's no extra cost. I'm sorry that I interrupted.
Yeah, you're describing, it's almost like if I was just to go out and catch an Uber or a Lyft, like I can see the car coming, I can see the make and model, the license plate, the driver, so the rider, the older adult, is getting that same benefit. Even if they don't have a smartphone, they're still getting that information.
They get it as a voice call. They get it as a automatic voice call, and I usually encourage my participant, try to have pen and paper when you're ready to request your ride, or if the ride is going to go pick you up at 7 a.m., try to grab a little piece of paper and write down the name of the driver and all that information, because they get it as a voice call if they don't have a cell phone.
Okay, all right, that's good to know too. How have you addressed any challenges that have come up with people using this transportation program? Any issues that you've been able to address?
To be honest, we have very few, and most of them has been more educating the population, ensuring them that the program works. But it's funny because it's the biggest issue, and I don't consider it a problem, is that sometimes consumers forget that we bill them for the ride, and they pay the driver, and usually the driver would take it as a tip. So that has been the biggest problem.
So instead of, the rider may forget that they're going to get a bill to their house for that ride, the $4 or the $8, but instead when they're in the moment in the car, they just think to pay the person. So it's been some education.
It's been some education, and it hasn't been an issue because we don't want to double charge our consumer, because if they pay the driver and they receive a bill from us, obviously our population is in need. They don't have extra money. If they're using us, it's because they need it.
Okay, that's good. But that's not surprising. It could be a little bit confusing for folks with that. Do elders and riders have the opportunity to share any feedback with you about like how their ride went and if they had any concerns or if they had any just feedback from the experience?
Most of them, they call at the end of the ride.
They do.
Just to, say how happy they are with the services. They feel, accomplished. And I think that's one of the things that Care Ride has been successful, because some consumers, they were relying on their family members or somebody else to go to doctor's appointment. And when they're able to go on their own, and they see how easy the program is, that gives
empowering.
them, empowering. So they call back and they just say, I was able to go to the doctor by myself. I didn't have to bother my kids. So the feedback has been pretty good. Very, 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 very positive.
Okay. So when I take an Uber or a Lyft, for example, like I'm rating my ride, do the riders, our older adults, have that option as well?
Yes.
Okay.
The consumers, they actually, at the end of the ride, they get a notification, thanking them, either by voice call or by text. And right from there, they can rate the app, rate the program. Like they can decide if they like the ride, they can put comments, and fortunate enough, we are 4.7 star out of 5.
Oh my gosh, that's the average so far.
That's the average
Like July through February 2020. That's pretty good.
Yes, and every month we can check every month, and every month has been almost the same, pretty consistent like that. Never have gone lower than that.
Good.
Yeah.
Can you talk about the impact of this program so far on the community? What has been the response?
Well, the response has been pretty good because, as I mentioned at the beginning, a lot of consumers choose to go to whatever doctor's appointment is more important. And some of them forget about like going to the eye doctor or forget to go to the dentist. And I have heard from consumers that they were not able to see their dentist in 5 years just because they chose to go to their primary care doctor because their blood pressure was more important. So just knowing that consumers are taking care of their health and managing their health better now, that has been a bigger impact. And all the feedback I get from consumer has been like that. Like we got calls from consumer who they're so happy because they were able to go to a dentist appointment after 5 years. And sometimes we take things for granted, and those are things that our consumer, our population, they really need, because going to the dentist and is something that make them feel good. And also, if you don't follow your dental health, it can affect other things. Yeah.
Can you talk about the numbers of how many people have used the program, how many rides? Do you have that?
Yes. When the program started back in July, on the first month, we got 32 referrals and we provide 30 rides. And since that point, the program has grown so fast, has multiplied, triple those numbers. Last month, we provide 107 rides.
Wow.
And from the first day until now, we have provided almost 800 rides, 767, and we got about 800 referrals.
Okay.
Yeah, and we have enrolled 357 clients.
Okay, unique clients.
Unique clients, yeah.
That's really incredible when you think about it, because almost 800 appointments actually being made. If you think about like the ripple effect of that person being able to go to their PCP, their primary or their specialist or the dentist, and the fact that if they had not had a ride, they literally would not have made that appointment. And to think that like almost 800 appointments have been made because people have a ride.
Yeah.
And that's incredibly powerful.
It is.
Wow.
Yeah.
As far as program growth, you've talked a little bit about that. The community seems to have like really caught on. And what is the process for like educating the community and letting them know that the transportation service is available?
We have done so much of outreach, and we thank you for that too.
It's a pleasure.
Yeah, because we promote the program around the Greater Lowell area. We have the information on our website, and also all the agencies that we're working in collaboration, all the COA, they're good at advertising and promoting our program because they know, even though most of them provide transportation for their consumer, they have seen that we can provide the extra help. For example, there are some COA, they provide locally rides. But some consumers, they need to go to Lehi or in Burlington, or they need to go to Boston. So they make those referrals to us. Yeah. So we work very close in collaboration. So I think that has been a good impact.
Okay. That's great. Thank you so much for sharing that. If someone does need a ride to a doctor's appointment, how do they get in touch with you?
Well, they can call me at the office. It's a direct line, and my number is 978-651-3118, or they can call their local senior center, get a referral through them, and immediately I receive the referral, I will give them a call.
Okay. So I have the pleasure of sitting with Alex at our office in Lawrence, and I get to overhear a lot of the calls that she takes from people looking for a ride. And I just have to say, you're incredibly patient with folks calling, and you're so helpful, and you really take the time to explain to them their options, and you're so reassuring. It really shows to me that you enjoy what you do. Do you want to just take a moment to share like what you love about doing this work and connecting people with this resource?
Oh my God, I'm so satisfied. I feel so happy every time I can help someone, because I know that if they're reaching out to me, it's because they really need it. And my biggest, my job is to make sure that they get from point A to point B. And just knowing that I'm making a difference in their life, that's all that matters. And, it's not only me, it's the teamwork.
Right.
Yeah.
Right. Yeah. Well, thank you for doing what you do. And again, it's a pleasure that I get to work with Alex and hear a lot of her side of the call. And just, it's been really cool to hear the response from the community and how grateful people are, and that, they're really valuing it as a support that they didn't have before. We're grateful to be able to help with that program and provide that to the community.
Thank you.
If you would like to know more about the Care Ride program or any of the services that Elder Services provides to older adults in the community, please give us a call or check our website or check our Facebook page. Thank you so much, Alex, for being here with us today.
Thank you for having me.
Thank you so much for joining us on this episode of Issue at Hand.